Welcome to AFMC TV. I'm Robin Linder.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of religious adults who were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Sam Makhoul, and he is a hematologist oncologist and director of clinical research at CARTI. Dr. Makhoul, thanks so much for being here.
Thank you for having me.
So we're talking about your research to improve adult immunization rates among patients with cancer. Tell us a little bit about that project.
Yes, I think we noticed during the pandemic that the groups that have paid the heavy price to mortality from COVID were patients with cancer, patients with heart failure, respiratory failure, or kidney disease. And as a result of that, the ASCO, American Society of Clinical Oncology, in collaboration with CMSS, decided to see if there is a way that those patients can get immunized against these pathogens, these viruses, before they get the infection. Mm-hmm. The vaccination, we knew it will not prevent the infection, but at least it prevents the severe infection. Mm-hmm. And severe infections were more common, 3 to 5 times more common in our patients. Mortality, unfortunately, was even higher, 5 to 7-fold more common in cancer patients compared to general population. So it made a lot of sense to try to increase the immunity of those patients before they encounter the virus, and in a way that they will be able to fight back.
What is the goal of this initiative for high-risk adults? Is it something, are you saying long-term?
It is long-term because honestly, if you don't die of an infection, we have an opportunity to cure your cancer. Mm. And if you get the infection and you are in the hospital and you end up being in the ICU, the likelihood that you will die of the COVID, the flu, pneumonia is extremely high. Mm. And the other thing that is important, patients who have cancer have higher probability to have shingles. Mm. And that actually stays with them for a long period of time. When it's active disease, you have the rash and the itching and the pain. And even though we can treat it and put it in remission, the infection itself, the virus doesn't go away. And every time we give them treatment or there is progression of the cancer or something, there might be activation of this virus and they suffer from another episode over and over. So doing the shingles vaccine, the pneumonia vaccine, COVID vaccine, flu, and Tdap. Tdap is for tetanus, diphtheria, and pertussis. Pertussis is whooping cough. And because the rate of vaccination of children has dropped significantly across the nation, and in Arkansas probably more than other states, unfortunately, we see every year a small breakout of pertussis here in central Arkansas and across the state. And my wife is a pulmonologist. She's a fantastic pulmonologist. I'm going to tell you that. But she shares with me all the time. She's admitting patients who have a whooping cough to the hospital because as adults, we don't have...
And it's contagious.
It is contagious. And then the child might be coughing a little bit, but the adult might go to the ICU. And that is a huge difference. Now, don't get me wrong. Children can also get severe infection that can be life-threatening. I'm not minimizing the seriousness of the infection, but for all these reasons, we thought that our patients who start coming to the oncology clinic, they practically are frequent flyers with us. They come every week, every 2 weeks, every 3 weeks, and many of them end up requiring general internal medicine or family medicine care, but they don't have the time to go and see their general practitioner or internist. Mm-hmm. So we become the source for all this service. And we thought that probably this is very convenient for the patients to make it available to them at the place where they are going to get their chemotherapy or immunotherapy or so on.
And the results you've seen are really incredible.
Oh, the results were amazing. Actually, we did this small survey with the patients to see if they are interested, because in the beginning we needed to convince everybody in our institution that this is the right move, And don't get me wrong, we have wonderful administration and people who are financially responsible, and they wanted to make sure that if we purchase these vaccines, the patients will take them. And so we ran a survey with the patients to ask them a simple question. Would you like, if these vaccines were available at CARTI, would you like to get them here? 76% of the patients said yes. And that was an amazing, overwhelming response. We shared that with our administration. They said, okay, sure, let's do it. And that was a part, the purchasing was on basically from our resources. The putting together the program to spread the awareness about the vaccination among the population that we treat, but also to raise awareness about the importance of the vaccination with our staff and nurses and doctors. So we formed a cohesive, committed and very engaged group of people, and we started preaching basically about it. And the uptake was amazing. So we were able to move the needle on many of these vaccination rates compared to the population of Arkansas, but also compared to the vaccination nationwide.
What does that look like nationwide compared to here?
Let me share a few things with you here. For example, we can talk about here the vaccination rate for the pneumococcal infection. We were able actually to vaccinate 75.8% of our population. And nationwide, it was somewhere around 69%. Okay. So we exceeded even the national average. And compared to a year before we started the implementation of the grant, we went up by about 15 percentile points, which tells you that there was a need for it on one hand, but also the presence of people who are convinced that this is the right thing to do for the patients was an important driver to make sure this thing happen.
And what have you learned about the level of trust patients place in their oncology teams when discussing vaccines, particularly in rural communities?
We face different preconceived ideas depending on the regions in Arkansas. If you look, for example, at the South, there is a lot of thirst for knowledge, for coming from a trusted source. And we noticed that because the patients trusted us on their lives. When you go to see an oncologist, if you don't feel comfortable, you don't come back. I'm telling you, and I know the patients. So using this trust to do the good thing for us from our end, the patients felt very comfortable accepting the idea of doing the vaccination. And this was strengthened certainly by the fact that the statistics were very strong in terms of prevention. The patients who got the vaccination, for example, were much less likely to be admitted to the hospital and much less likely to die from the infection. So sharing this information and creating space where the patients feel comfortable. The most important thing in our mind was it's not about forcing anything on anybody. It's only sharing the information, making sure that we can appease their concerns and answer their questions in a very well-structured way and let them make the decision. And I have rarely noticed that somebody that was, completely opposed to the vaccines, that after we have this discussion, they would say, no, I still don't want it. Sometimes it happens, but it wasn't common, believe it or not. And that's how even our vaccination rate for COVID for the state here of Arkansas was 19%, nationwide wise was 21%, and our program was 42%.
Oh, wow.
That was twice as high as the national rates. And we had for the flu also, we reached much higher rates than national averages. We were in the 60+%. National average were like in the mid-50s.
So what practical steps did CARTI take to assess and improve immunization rates? Practical when you say what impact did workflow tools like verification systems have?
That was, the most important, believe it or not, difficult step forward, because you cannot improve what you cannot measure. So the first thing that we said, how can we assess the vaccination rate among our population, right? And then it required that we would introduce certain changes to our EMR to allow us to, at the point of service, when the nurse or the doctor are seeing their patients, to be able to go and input that information into the computer so we can generate data baseline at the beginning. Then as we went through the process, if we were improving or not. And that was truly thanks to the commitment of our IT department. They created the module for us that allowed the nurses, whenever they are asking the patients to see if the patients, for example, have had the vaccine, if they didn't, would make a recommendation. We wanted to make it simple. Yes, no, we recommended it. And every time the nurse would click on the button, for example, it would populate a space saying, what that means. Because the definition, for example, the definition of the fully vaccinated for COVID, do you remember how many times it has changed?
Yes.
In the beginning, you needed to take the first injection, then the booster, then the booster. It was very complex, honestly, and it was very difficult. So once we have attested that somebody was fully vaccinated, we did not need to write all those details. There is a text that would come from the belly of the computer and populate the space. And that's how we were able to, first of all, establish a baseline. That was our floor, and from which we started going upward toward achieving our goals.
So it was really a multidisciplinary approach. So between physicians, IT, even nurses and pharmacists that really make an effort to make this successful.
Oh, absolutely. I think the contribution of everybody was unbelievably important. And in every phase of the implementation of this program, we delegated the leadership to the person or the party that was to lead that part. During, for example, the creation of the assessment tool, the IT people led the issue. When we talked about the acquisition of the vaccines, the pharmacists led the issue. When we talked about the administration, the nurses became the leaders. And as a result of that, I think I have to pay tribute to all the team members that contributed to that. But I want to tell you, without the nurses, this would not have happened. Our nurses, committed to serving the patients, knew deep in their heart and their mind what was important for the patient. And that led the entire transformation of the culture. We wanted something not to happen because we had won the grant among the only other 7 institutions across the nation, by the way, but we wanted to make sure that we can achieve what we call sustainability of the program. The grant was really to start up the whole thing, but after that, how can you sustain the program without being committed that this is the right thing?
And many patients say they prefer to receive all recommended vaccines at CARTI. And what does that tell you about access and convenience for high-risk populations?
I think that tells us a lot about our conditions here in the state. We are the only kind of majority rural program among the 8 programs that were selected or awarded the grant. And people were very astonished about how could you do that when you are so splintered and are all over the place. I think the most important factor about that is the patients who came to CARTI to receive their anti-cancer treatment unfortunately did not have a lot of options to receive medical care otherwise, and that made it very practical for them to receive the vaccines at CARTI. And with this in mind, I think the word of mouth started playing a role. There was one thing that we could not do, and I hope that we will be able to do in the future, which is vaccinating the family members. Because by virtues of the design of this program, we were allowed to vaccinate the patients. But we are really working hard with our administration as well as the regulatory aspects of it and so on to vaccinate all family members, because it's not only enough to vaccinate one member of the family. You need really to protect the entire support system that surrounds the patients. And this is the only way that you can make sure that the virus doesn't come even close to them, right? Because even if the patients are vaccinated and protecting themselves with, masks and washing their hands and everything, if the family member brings the virus home, all this might fall apart.
So before we go, tell us, what advice would you offer healthcare providers and leaders across Arkansas about strengthening adult immunization efforts for medically vulnerable patients?
I think the most important thing is to be ourselves, to visit our deep convictions in our heart, and to make sure to understand that that one shot that costs probably $200 can save a life. And we give, like sometimes, immunotherapy or chemotherapy that costs $200,000 to save a life. For me, the return on investment is clear. At $200 that saves life, it's no-brainer for me. That's on one hand. But on the other hand, isn't it not kind of really we are abandoning our role to look at the whole person when we don't want to give the patients something that can save their lives? Even if it's not here, we're not talking about oncology treatment.
Well, Dr. Makhoul, thank you so much for being here and sharing this important information and about your research and what you're doing for patients across the state. Thank you.
Thank you for having me. I would be happy to come back anytime you ask me.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.